process we must understand that whatever events are taking place, there are three events which take place: testing, and those who are tested, and then those who are positive. This is done almost simultaneously. But thereafter, what is the outcome of those who test positive for COVID? They recover, some of them get hospitalized, and unfortunately, some lose their lives. So these three steps, there is a delay between the events taking place and uploading on the national database. And this is not the first time. There have been other states, I'm sure we remember from several other states, where backlog of deaths was reported after some time. And I think similar event has happened in Kerala also. And here I would like to emphasize that according to NCDC, particularly there is a difficulty in getting the correct information about hospitalization rates. And that's a very important, because that helps in understanding the health system needs. And most of the states have got incomplete data as far as hospitalization is concerned. And therefore, I would suggest that NCDC and the states work together on this issue so that the discrepancy between a case occurring, getting hospitalized, and death, these are done as much real time as possible, because this helps in planning process. See, Kerala had done very well, and when the last Zero survey came in July, only 44% people were Zero positive. That means 60% of the population was Zero negative. And it appears that virus, this Delta virus, entered there and has rapidly spread. So 60% of the Kerala population was susceptible. And during last 3-4 months, July onwards, we are seeing huge upsurge of cases. Fortunately, for last 2 weeks, we are seeing gradually a decline. And this indicates two things. One is Kerala's vaccine history is very good. I mean, they are using vaccine, and fully vaccinated numbers are proportionately very high. The second thing is, I think most of the people are those who have been vaccinated, who are not vaccinated, are now getting infected, and their numbers are decreasing, and therefore it is like a tail. And we hope that in next 1 or 2 weeks, the number of cases will further decline. But overall, it means that Kerala is a very good example that Savdhani hati, Durghatna ghati. If we let our guards down, the infection can again spread, because nationally 20 to 30% of the people are still uninfected. And during the forthcoming festival season, if we do not follow 4 things: one, vaccination; the second is mask. Social distancing is very important, because social distancing does not mean only keeping 2 gaz ki duri, but also keeping away from crowd. And fourth is hygiene. All these things will have to be continued. Otherwise, we may see localized upsurge of these cases where the number of susceptibles are still very high. And therefore, I would request our people that they should follow the discipline and continue to remain restrained